Let's look at the benefits of face massage in general, so any kind of face massage. It increases venous and lymphatic circulation to the face. In effect, this means you're getting more nutrition taken to the tissues and more waste products taken away. It relaxes the muscles, and this is really important because in fact our face muscles, we use them all the time when we're awake, so they hardly ever get a chance to relax completely, possibly when we're asleep. It helps to make the face more expressive. There are in fact certain types of massage which are targeted at actors to make the muscles more supple, and that means the face can be more expressive. So it's in fact the opposite of Botox. Desquamation. What this means is the simple act of rubbing the surface of the face is going to help to get rid of the surface layer of dead skin cells, so make the face look more alive, more vibrant. It stimulates cellular function and renewal, so again it's going to make the tissues healthier, younger. It stimulates the facial nerves, and this is going to help to keep all of the muscles of the face toned. It relaxes the mind and feels good, and in this day and age, relaxation is of prime importance. And in the spirit of zero strain for the therapist gets to sit down. Contraindications and cautions. There are very few absolute contraindications for massage, meaning you can't massage this person at all. Usually it's a grey area, it's a caution, it's an adapting the massage to this client, and always it's about asking the questions to get the information you need to decide whether you can proceed as normal for this massage, whether you need to adapt it, or whether you can't do it at all. If you're a qualified therapist, you will already know the global contraindications and cautions for massage. And if you're not a qualified therapist, I strongly recommend that you only work with healthy people or seek medical advice. Now it's probably a good time for my disclaimer. Contraindications when you don't massage at all, cautions when you need to adapt the massage. And here we're going to look mostly at contraindications and cautions that apply specifically to Tsuboki face massage. Always use your common sense, and if anything doesn't feel right, don't do it. So hypersensitive skins, the skin on the face can be particularly sensitive. And if you know that, you may wish to massage more lightly or not do it. The same with extremely vascular skin. So these are skins which have a lot of thread veins, red veins, broken veins. Again, use your common sense. Acute inflammation or swellings, this would be a no-no for massage. Infectious skin conditions, contagious illness. Well, if it's something localised like cold sores, you could maybe avoid the area, but any colds, flu, that sort of thing, I would steer clear. Long-term diabetes or long-term steroids, both of these conditions can cause thinning of the skin. And so if the skin looks particularly fragile, again, decline or adapt the massage. Procedures such as Botox in the last 3 weeks, well, massage will negate the effect. If a person has epilepsy, in this massage there is a possibility of doing really lovely deep neck work, but I would avoid that deep neck work with somebody who has epilepsy. Also, avoid the tapping techniques. But each person is different, so check with your client. See what's okay and what's not. Pregnancy. Face massage in pregnancy is fine as long as you can position the woman comfortably. But what I would do, if you're not a shiatsu practitioner, completely avoid the tsubo and meridian part of the massage. So no points in pregnancy, just to be on the safe side. The same is true of frail, elderly or chronically ill patients in terms of the meridian part of the massage. When you press tsubos, you're asking the client to do the work. So if you do too much of that, that could be quite exhausting for somebody who doesn't have a lot of energy anyway. Contact lenses, these days with soft contact lenses, probably not an issue, but it's not a bad idea to know whether your client is wearing them, just in case you intuitively decide to put your fingers on their eyes. Recent dental work. Well, any kind of pain is a contraindication for massage, and so you may need to avoid certain techniques or certain acupressure points if they're going to cause pain. Hearing aids, best taken out or at least turned off, because if you put your hands near one when it's on, it can cause an unpleasant ringing sound in the ears for the client. And once again, if you're not a qualified practitioner, massage healthy people.